Hi, I'm Dr. Becky Pace with Meal King Physical Therapy. Today, I'm sharing my top 7 foam rolling techniques to help relieve muscle tension, improve mobility, and keep your body feeling its best. Foam rolling, also known as self-myofascial release, helps release the tightness in the fascia. That's the connective tissue that surrounds your muscles. It's an excellent way to target sore spots, increase circulation, and improve your flexibility. Today, I have Cody with me. She's one of my physical therapy assistants at the Macomb location. So let's get ready, get your foam rollers, and get started. We're gonna start with a thoracic mobilization. So you're gonna be on your bottom with your feet flat on the ground, starting with the foam roller at the base of the mid-back, around the rib cage, and slowly roll the foam roller all the way up towards the base of your neck and all the way back down, right before you get to the low back area. You wanna keep your core gently engaged just to stabilize through your low back. And then once you feel comfortable with loosening up the muscle tissue, you can drop the bottom down and allow your shoulder and upper back to extend over the foam roller. You should feel a nice stretch in throughout the spine. And again, it might be a little uncomfortable, but it should not be painful. You can move the foam roller up a little bit more. Right around the shoulder blades, you're gonna wanna keep the elbows tight and pointing up towards the ceiling so that your shoulder blades are clearing your thoracic spine. Next, we're gonna work into the glute muscles. The glutes can get really tight when you have any sort of pelvic floor dysfunction, low back issues, or hip issues. So starting from the very top of the pelvis and working all the way down towards your sits bone. And you can add the foot over the knee, creating a figure 4 type stretch to add a little bit more pressure onto the one side. Moving into the hamstrings, again, we'll start with both. You're gonna use your arms to support behind you and roll it all the way down from the ischial tuberosity, which is your sits bones, all the way to the bottom of the knee. Remember, there's a lot of sensitive structures behind the knee, so you don't wanna go too far behind the knee to create any sort of pain into your sciatic nerve and irritate those symptoms. But there is 3 different hamstring muscles, so you wanna make sure you hit the outside as well as the inside to allow the best mobility throughout the hamstring muscles. Next, we're gonna move into the calf. The calf is comprised of the gastrocnemius as well as the soleus. Gastroc is more so the superficial muscle that is at the first part of the behind the knee, and it has 2 different heads, the inside and the outside. So make sure, again, you kind of rotate that calf around and get both the inside and outside portions of it. And then as you get lower into the mid to lower calf, you're gonna hit more of that soleus muscle, and you'll make sure you roll all the way from mid to the lower ankle to improve some ankle mobility, knee range of motion and discomfort. Next, we're gonna be working into the quadricep muscle. The quadricep is comprised of 4 different muscles, and it goes all the way from the top part of the hip in the front and across the knee, across the kneecap. Again, we're not gonna roll over the kneecap because that would be uncomfortable, but start at the top of the hip and work your way all the way down to the top of the knee. When we're sitting all day, the hips get really tight, and so working into that front part of the hip can be very beneficial for addressing low back pain and tightness or hip tightness. And you can add some knee mobility by bending the knee back and forth to add length into the quadriceps to get a little extra stretch. Next, we're gonna work into the tibialis anterior. This is a great muscle to foam roll with runners. It's commonly involved with shin splints. And so you're gonna go from the top of the knee on the front side of the shin all the way down to the top of the ankle. You can work one side at a time, or you can put both knees on and allow your toes to kind of sit onto the mat and get an extra ankle stretch as well, and hold that position. Remember, with foam rolling, you don't always have to roll the entire time. You can find a spot and hold it there and add movement to get extra mobility into the joints. Next, we're gonna work into the IT band. The iliotibial band is commonly known to be tight. However, it is a thick piece of fascia, so itself does not get tight, but the tissues around it get tight. So we wanna work all the fascial tissue around it and the muscles like the quadriceps and the hamstrings. You can also get up to the top of the hip near your tensor fascia lata to help release there. And you're working from the outside top of the hip all the way to the knee. We're gonna add a little bonus stretch at the end that's great to use with a full foam roller. You're gonna line your spine up from the tailbone all the way to the head to add support. Knees are bent, and then both arms are gonna come out to the side, and you're gonna gently stretch out your pectoralis muscle. This is another big muscle in the front part of your chest. We can change the angle of the shoulder to change the different stretch in the different fibers. With your arms overhead, we're stretching more of the lower fibers. And if the arms are a little bit lower down towards the feet, you're stretching more of the upper fibers. Foam rolling is a simple and effective way to release muscle tension and stay flexible. Try these different techniques daily or after workouts for the best results. Remember, foam rolling should be a little uncomfortable, but it shouldn't be painful. So listen to your body and adjust as you need to. There's so many different types of foam rollers out there, from the smooth, soft ones you saw today to ones that are smaller, firmer, different textures. And if your body doesn't like some of those, you can always change it up and use a massage roller or a massage stick instead. Thank you for watching. My name is Becky Pace, and we hope to see you next time.